Hi, my name is Mandy Bilski. I'm a certified occupational therapist as well as the Director of Marketing and Sales for Millennium Medical Products. I represent LIFTEM, the only portable patient lift on the market today that can pick, lift, and transfer a patient electrically without ever having to physically move the lift. To start a product demonstration, we'll look at the base. The base can open and extend for a wide base of stability during all transfers. The AC plug that plugs into a standard wall socket, the mast, the 8 push-button remote, which we'll go to further detail later, the boom, spreader bar, which we have 5 different slings to accommodate varying degrees and diagnoses of injury or handicaps, the rear locking brakes. Always remember to push down on the rear locking brake before you perform any transfer. To unlock the brake, simply lift up on the brake. Next is the handle. With the handles, we're easily able to maneuver the lift around the bed or around the hospital. We have the battery charger. With a fully charged battery, we can lift up to 70 transfers. The lift actuator, the emergency pull-down button. If all power fails, simply push up on the emergency button and the patient will be slowly lowered to the ground. This completes our patient lift product feature demonstration. LIFTEM has an 8 push-button remote control panel. All of LIFTEM's lift and transfer capabilities can be performed electronically. We are viewing LIFTEM now in its stored position. To initiate a transfer, we press the open button under leg spread. Once the legs have been fully spread, we must now press the out button under leg extend. With this increased base, we are ensuring patient and caregiver safety during all transfers. The legs must be fully open and extended at all times during all transfers. Failure to do so may endanger both the caregiver and patient. We're now ready to lift the patient up off of the bed. Press the up button under boom lift. If a patient falls, we're also able to lift the patient from the floor. The maximum height of the boom is almost 90 inches. However, you only need to clear the patient's feet off of the bed for a safe transfer. Next, we either push the right or left button to transfer our patient. The right or left button is located under boom rotate. Once the patient is positioned over the wheelchair or commode, we press the down button under boom lift. This will slowly lower the patient into the wheelchair or commode. To put LIFTEM back into the stored position, simply reverse the procedure. It's as simple as that. Prior to using LIFTEM, log burrow the patient onto the appropriate sling. Now we're ready to begin the lift and transfer process by positioning LIFTEM at the base of the bed and making sure the spreader bar is over the patient. Lock the rear brakes and come around and lower the spreader bar above the patient. To attach the sling, make sure that the bands on the sling are not twisted. For demonstration purposes for the video, I'm going to attach a sling from the other side to clearly illustrate how it's done. Now I want to open the legs of the lift and extend them out. With the opening and extension of the legs of the lift, this gives us a wide base for a safe and secure transfer, lift and transfer. Now I'm ready to position the wheelchair next to the patient. Right about at the patient's chest, and I want to position the wheelchair as close to the bed as possible. Always remember to lock the brakes of the wheelchair before transferring the patient. Now we're ready to begin the lift and transfer process. I always want to make sure I'm very close to the patient at all times during the lift and transfer. I can either hold on to the spreader bar or the sling. I oftentimes ask patients if they're comfortable, if they feel secure during the transfer. Make sure you lift the patient up as high as possible to clear the arms of the wheelchair. I can now move the patient over and transfer him to the right. Once the patient is positioned over the wheelchair, I can slowly lower them down. If necessary, I can realign the wheelchair with the patient by coming in the back and lining them up properly. I can lower the lifting bar so I can detach the part of the sling. Come back and lift the spreader bar out of the patient's way. We have now completed a safe lift and transfer.
LIFTEM's uniquely engineered design allows it to perform a patient lift and transfer from virtually any position around the bed, from the head of the bed, from the side, or even from the base. LIFTEM can easily be maneuvered by a single caregiver, even with varying room configurations and circumstances associated with patient lifts and transfers. This video was a brief demonstration of LIFTEM. For more details, refer to your manual or call the number on your screen.